Assalamualaikum, this is Dr. Dua. So let's continue our topic of diabetes. Type 2 diabetes and pre-diabetes are conditions that affect millions of people. They can lead to heart disease and stroke, which are first and third leading causes of death and disability. People with diabetes and pre-diabetes develop problems with their vision and lose feeling in their limbs. They may develop liver and kidney disease and are at risk for heart attack and stroke. However, type 2 diabetes and pre-diabetes can be avoided and risks can be reversed. Diabetes is a complex disease that affects many parts of your body but is caused by the way your body mishandles the food you eat. After a meal, food is broken down into sugar molecules called glucose. Glucose travels through the intestines into the blood where it is carried to all different areas of the body and is used for energy. There are some parts of your body that need help absorbing the glucose molecules and require a special hormone called insulin. Insulin is formed in the pancreas and circulates in the blood with glucose to the cells that need help significantly: liver cells, fat cells, and muscle cells. When the body develops resistance to insulin, increasing amounts of insulin are necessary for it to be able to utilize glucose. Initially, during insulin resistance, your pancreas will work on overtime to produce more insulin. This can happen even when your glucose levels are relatively normal. If tests reveal abnormally high insulin levels, a condition called hyperinsulinemia, along with insulin-resistant markers, your body shows initial risk for developing diabetes. Lots of insulin in your blood also affects the production of lipids and lipoproteins, which are the small particles that are broken down from cholesterol molecules and fat products called triglycerides. These particles are small enough to travel in your bloodstream but can be dangerous in large amounts when they build up in your blood vessels. In the presence of elevated levels of your insulin in your body, especially your liver shows or releases bad cholesterol particles such as VLDL, and the higher your insulin levels, the more bad cholesterol particles are circulating in your bloodstream, a condition called dyslipidemia. Furthermore, adiponectin, a hormone released by your fat cells that helps break down lipids, in particular fatty acids, is often low in obese or insulin-resistant patients prior to developing type 2 diabetes. While such lipid and lipoprotein markers are traditionally tested to measure cholesterol, they also provide insightful clues on the extent of insulin resistance. After a while, the pancreas will become overworked and the special beta cells that produce insulin will begin to die. Some tests will measure how well your beta cells function and if they are showing strain. Beta cell dysfunction means that your body can no longer make enough insulin to help your cells take up glucose for energy, and high levels of glucose will remain in your bloodstream, a condition called hyperglycemia. When insulin levels are low, your body may react in a number of ways. Some of these cells that use insulin control glucose, they have ability to store glucose. Liver and muscle cells will begin to release stored glucose when insulin levels are low in order to provide the body energy. Without adequate levels of insulin, in the presence of insulin resistance, more and more glucose is released into the bloodstream and the effects of hyperglycemia are lightened. Markers of glycemic control are usually measured during periods of fasting when your blood sugar should be low. Test results that demonstrate consistently high glucose levels are a defining characteristic of prediabetes and diabetes. To summarize how diabetes develops, let's review the main features. High insulin levels mark the beginning of insulin resistance, the primary mechanism that leads to diabetes or prediabetes. Abnormal levels of lipids and lipoproteins, the hormone adiponectin, may further indicate insulin resistance. A drop in insulin production by pancreas occurs from strain in the hormone producing beta cells, and beta cells dysfunction eventually leads to an insulin deficiency. Without adequate levels of insulin, your body's ability to control glucose levels is disrupted and glucose levels increase, defining the onset of prediabetes and diabetes. Too much glucose circulating in your blood, hyperglycemia, and too many harmful lipids circulating in your blood, dyslipidemia, are two conditions that are characteristic features of diabetes and prediabetes. Left untreated, they cause serious damage to blood vessels, leading to a variety of complications. Excess levels of lipids and lipoproteins particularly can build up, create a plaque in your blood vessels. This is highlighted in the presence of excess glucose molecules and fatty acids due to the blockage in your blood vessels cannot circulate into your limbs. The nutrient and oxygen carried by your blood cannot nourish your body's extremities. Build-up causes vessels to expand and squeeze the nerves that course alongside them, leading to a condition called neuropathy. Damaged nerves can cause numbness and keep your body from healing normally, and they can cause your muscles to weaken and eventually atrophy, sometimes requiring amputation, and you may experience sensory changes including blindness. Involuntary functions such as blood pressure, heart rate, and even sexual function may be abnormal as a symptom of neuropathy. Enlarged vessels like these supply your heart and your brain. Plaque buildup leads to a condition called arteriosclerosis. Over the time, plaque can grow and rupture, which can cause cardiovascular disease or heart attack. Iron in the brain lead to a stroke. Arteriosclerosis further contributes to end organs like kidney or liver disease. Assalamualaikum, this is Dr. Dua. So let's continue our topic of diabetes. Type 2 diabetes and prediabetes are conditions that affect millions of people. They can lead to heart disease and stroke, which are first and third leading causes of death and disability. People with diabetes and prediabetes develop problems with their vision and lose feeling in their limbs. They may develop liver and kidney disease and are at risk